Have you ever wondered how doctors deal with patients who are on the edge of life? Hello everyone and welcome back to my channel. I'm Caitlin, future doctor, and today we are going to be talking about palliative care. So we are going to be talking exactly about how to implement palliative care in Lebanon or any other country. But first of all, you might ask yourself, what is palliative care? It's pretty simple. Palliative care is medical care that relieves pain, symptoms, and stress caused by serious illnesses. It's generally provided to the patients and their families. Yep, you heard it. Palliative care is not only reserved for patients who are on the edge of life, but also for patients who have serious illnesses like cardiovascular diseases, cancer, major organ failure, drug-resistant tuberculosis, severe burns, acute trauma, extreme birth prematurity, or extreme frailty of old age, and many more. In Lebanon, patients opt for palliative care when they are at an advanced level of cancer or other illnesses where the healing is impossible. Why should we opt for palliative care? When a patient suffers, palliative care improves the quality of his life and that of his family. It relieves suffering through early identification and provides support to the patient in its four domains: physical, mental, social, and spiritual. Who provides palliative care? Well, in general, the palliative care team is composed of a doctor, a nurse, and a social worker. However, according to patient needs, other experts can join the team. The team can tend to patients at their home. How many people need palliative care? According to WHO, the World Wide Health Organization, an estimated 40 million people are in need of palliative care. However, only 14% of those patients are receiving it. In Lebanon, approximately 15,000 people need palliative care, but due to the rise of diseases and the aging population, this number is increasing. Only a few of these patients are receiving palliative care. But why? There are so many reasons. First, there is a lack of experience in the field. Palliative care services are now available in several hospitals in Lebanon. However, specialized palliative care services are limited, and only 2 medical schools have integrated palliative care in their programs. But the most important reason palliative care is not widespread in Lebanon is because it is not covered by public and most private insurance companies, due to the lack of laws that support palliative care development and integration, thus transforming palliative care in the mind of the population into a luxury treatment only designed to steal money from rich people rather than a necessary treatment. Also, due to the traditional Oriental mentality, palliative care is mostly associated with dementia. For some patients, any treatment that supports mental health is never well appreciated. Patients also associate palliative care with death, which makes them refuse the idea. But others realize the importance of palliative care for patients and founded NGOs like Balsam, Sanad, and ALSP Saint-Benoît, founded by Dr. Elie Moubarak, to provide palliative care services for free. Finally, how to implement palliative care in Lebanon. Compared to France, Lebanon is late in palliative care about 30 years. To implement palliative care, first it is important to enact laws that force all hospitals to provide palliative care services and all insurance companies to cover it. Furthermore, we should improve palliative care formation in medical schools and provide palliative care programs in both public and private medical schools. After providing palliative care in hospitals, it is radical to change the mindset of the Lebanese community in order to implant palliative care in our mentality. This can be done by organizing conferences, creating accounts on social media that raise awareness about this subject, and many more ways. Thank you for watching this video. Don't forget to like it, subscribe to our channel, and tell us in the comments your ideas to raise awareness about palliative care in your community.